On September 9th, 2025, in a U.S. Senate hearing, attorney Aaron Siri revealed a study that was hidden from the public for years, a study comparing vaccinated and unvaccinated children. Hello, this is Dr. K. Paul Stoller, and that study, conducted within the Henry Ford Health System, analyzed health records of more than 18,000 kids. What it found was astonishing. Vaccinated children were more than 4 times as likely to develop asthma, 3 times as likely to have allergic conditions, nearly 6 times as likely to develop autoimmune disease, and over 5 times as likely to suffer from neurodevelopmental disorders. But, despite the significance, the results were never published. The researchers, strong vaccine supporters themselves, feared losing their jobs and reputations. At the hearing, Siri testified that the authors initially promised to publish regardless of outcome, but higher-ups at Henry Ford Health blocked the study, leaving it buried for years. Siri has now released excerpts in his new book arguing vaccines should be treated as consumer products, not objects of worship. Other witnesses highlighted the larger issue. Studies without true unvaccinated control groups can't answer critical questions. Yet when studies do include unvaccinated children, they often suggest higher rates of autism and chronic illness in the vaccinated, findings that have been systematically ignored. Researchers stressed that genetics alone can't explain today's epidemics of autism and chronic disease. Environmental factors, including vaccines, must be investigated openly and without bias. The Senate hearing entered this suppressed study into the congressional record, hoping more Americans will open their eyes to the need for transparency, honesty, and real science. Truth can't be hidden forever.